Alright, you're welcome. Today we're discussing impacted earwax. Okay, so before we go to the impacted earwax, let's just have a quick review of the anatomy of the ear. So the ear is divided into three main parts, which is the outer ear, the middle ear, and the inner ear. Okay, so we have the helix. Okay, we have the auricle, which contains the tragus and the lobule. Then you have the external auditory canal, which leads us to the tympanic membrane. That's where the middle ear begins. So the outer ear is in brown, and the middle ear is in purple. Then the tympanic membrane, then you have the auditory oscus or the ear oscus, which are the malleus, incus, and the stems. Then we also have the eustachian canal, which connects the middle ear to the throat. Okay. Then we have the one in light blue, which is the inner ear, where we have the semicircular canal, which is involved in balance. We have the vestibulocochlear nerve, which is the eighth cranial nerve. We also have the cochlea, the oval window, and the round window. Okay. Now we come to the structure of the tympanic membrane, where we have the pars flaccida, we have the posterior malar fold, we have the pars tensa, then we also have the anterior malar fold here. Then you also have the lateral process of malleus, the hand of malleus here. We also have the umbo and the cone of light, which is shining. Okay, so now what is earwax? So we are saying earwax is a complex substance consisting of a mix of cerumen, foreign air particles, and discriminated skin. Newly formed earwax is yellowish whitish in color and it is soft. Long-standing earwax is usually grayish dark and brownish in color. What is impacted earwax? So impacted earwax is a condition of the external ear in which there is accumulation of wax too hard to be washed away naturally. Now, what are the signs and symptoms of impacted earwax? Number one, we say tinnitus, which is the ringing sound that the patient will be experiencing, dizziness, itchiness. There will also be hearing loss and the feeling of fullness on the affected area. Remember, these are just some of the signs and symptoms. What's the diagnosis? How do we diagnose? So the diagnosis will be history-based, based on what the patient will be telling you or the clinical picture. Then you can also use otoscopic examination. So in doing otoscopic examination, you use an otoscope. Okay, remember when you are using an otoscope, when you're examining the right ear, use the right hand as you are holding an otoscope, like the way you are holding a pen. So right ear, right hand. And left ear, also left hand. Okay, so this is an otoscope. Okay, so what's the treatment? So when we come to the treatment, we use wax softener, which the patient can be applying twice daily, that is to soften the earwax. Then you can also remove the earwax using a Havel loop. Okay, so when you're using the Havel loop, you need a good source of light, so you can use this headlamp in order to scoop the wax. So this is a Havel loop that can use to scoop the earwax. Okay, so this is a source of light. Okay, then you can also do ear syringing. Okay, so when you are doing ear syringing, this is a syringe that is used when doing ear syringing. Okay, yes. So there are some other syringes which have got a long tip here, which is used when using ear syringing. But if the others does not have a long tip, you can also use a cannula, which I'm not going to open since I don't have a patient. Okay, so when you are doing ear syringing, remember, need to be gentle and there shouldn't be any pain, and you should be hitting the roof of the external auditory ear canal or the sides, not direct on the tympanic membrane. There is something that you need to take note of. That is, do not use hot water or cold water when doing ear syringing. You can use lukewarm water. Okay, so when you use hot water, you might injure the patient by burning the patient tympanic membrane. Then you can also, if you use cold water, the cold water can cause dizziness. What are the contraindications of ear syringing? Number one, the patient with perforated tympanic membrane. Number two, otitis externa. Number three, history of ear surgery. Number four, uncooperative patients. So remember, even children who are uncooperative, you are not supposed to take a risk of ear syringing. You might injure the patient. Okay, thank you very much. Until next time. But remember, this channel is not a substitute of the hospital and the school. Bye bye.